Results will be tallied across everyone who participates, so we will not see your individual responses. There are two ways that you can participate. First, open the camera on your phone and scan the QR code that appears on the screen. Two, or you can go to slido.com on your phone or computer and enter the number on the screen, 4960207. That website again is Slido, SLIDO.com. And again, enter the number on the screen when prompted. We will share this information again before each polling question. Basically, we'll know your responses, know kind of how you feel about the information you're receiving. The health information contained herein is for general audience and provided for educational purposes only. This information is not intended to replace discussions with a healthcare provider. All decisions regarding patient care must be made with a healthcare provider, considering the unique characteristics of each patient. In other words, we are sharing this information to help you learn more about a health condition. This does not replace the need to speak to a healthcare provider. All decisions about your healthcare should be made after talking to a healthcare provider. Again, this is because everyone's needs are different. Okay, so I'm going to take you to our first Slido question, question number 1. And before we jump in, I'd like to check in our audience to learn about how heart conditions may or not impact you. So our first question is, are you or someone you know affected by a heart condition? First question answer is yes, 2 no, or 1 not sure. And I'll wait your response. Okay, so it looks like everyone in this room has touched or knows somebody who suffers from some type of heart disease. Heart conditions affect a lot of people in our community and maybe even some of us sitting in this audience. So that's why today's presentation is so important. Without further ado, I would like to introduce our first speaker, Dr. Albert Hicks, advanced heart failure transplant cardiologist, Medical Center of Cardiac Transplantation, University of Maryland School of Medicine. Dr. Hicks discloses he's a speaker for Pfizer and a speaker for Allen. This promotional speaker program is being sponsored by Pfizer Incorporated. Speakers are not employees of Pfizer, but have been retained to present on Pfizer's behalf. For our audience members, please use the Q&A. If you'd like to ask a question at any time during the presentation, you need to click on the box that says anonymous. It's important. You need to click on the box that says anonymous before submitting the question. If you don't, your question will be deleted. In-person attendees can submit their questions to one of the hosts or hostesses, which is Roger Clark, to be entered on your behalf. We will try to answer as many questions as we can during our time together. This promotional speaker program, again, is being sponsored by Pfizer. Speakers are not employees of Pfizer, but have been retained to present on Pfizer's behalf. Without further ado, our speaker, Dr. Hicks.
Thank you, Wayne. And thank you, everyone, for joining us today. We're here as part of an initiative called Voices for the Heart. Voices for the Heart is a program dedicated to raising the awareness of ATTR-CM, a rare heart condition that impacts Black, African American, and Afro-Caribbean communities. As part of this program, Pfizer is teaming up with groups in the community to do one of 2 things. First one is to explain the warning signs of a heart condition called ATTR-CM. And the second is to help people who might have this heart condition to talk to their doctor about it. So hopefully by the time we finish this presentation, you'll be armed with a lot of that information. So what are we talking about today? First, we're going to talk about heart failure and how it affects Black, African American, and Afro-Caribbean communities. It's a condition that I take care of very frequently as a heart failure and transplant cardiologist. We're also going to talk about ATTR-CM, health condition that is linked to heart failure. After that, we will talk about the steps to find out if you have a hereditary form of ATTR-CM. There are going to be 2 main forms that we talk about, and the hereditary form is the one that we're going to focus mostly on. We will share some information that is available to help you learn more about the condition. Now, towards the end of the presentation, we'll hear from Ms. Velma Henderson, who is living with hereditary form of ATTR-CM. And finally, I'll be available to answer any questions you may have near the end of the presentation. As a reminder for our virtual audience members, please use the Q&A function and click on the box that says anonymous before submitting a question. We will try to answer as many questions as we can during our time together. Remember, you can submit your answers for me at any time or questions for me at any time during the presentation. So the first question that I think we need to answer is, what is heart failure? So we'll talk about heart failure and how it affects Black, African-American, and Afro-Caribbean communities. So heart failure is a condition where the heart becomes weak, damaged, or stiffened. As a result, the heart does not pump blood as it should. One definition I like to use is the heart is unable to meet its metabolic demands. So the heart's unable to meet the demands of the body. That's the basic definition of heart failure. Now, although heart failure is serious, it does not mean the heart has stopped beating or stopped pumping. Heart failure usually starts slowly and gets worse over time. It's important for us to remember that heart failure is more likely to affect Black, Afro-American, and Afro-Caribbean communities than any other community in this country. So what are some symptoms of heart failure that we can see? People with heart failure may feel very tired or weak, which is also known as being fatigued. But one key feature of heart failure is that you can develop shortness of breath. So the feeling of shortness of breath, especially when you exercise, and if it gets worse, it can happen at rest. You may have an irregular heartbeat associated with it called a cardiac arrhythmia. And then some patients, when their heart's not pumping properly, will start to gain fluid. So you're holding on to fluid in your legs. Sometimes your ankles and your feet may start to swell. So some possible causes of heart failure are numerous, but we'll focus on just a few here. Earlier, we talked about how heart failure may happen when the heart muscle is damaged because of another condition. Some of these conditions include a previous heart attack or high blood pressure. But heart failure can also be caused by a variety of other health conditions. We're here today to talk about one of those conditions, ATTR-CM. So in summary, some key points to remember from this section are heart failure is a condition where the heart muscle is weak, damaged, or stiff. It means the heart is not pumping blood as well as it should. Heart failure is more likely to affect Black, African-American, and Afro-Caribbean communities, and heart failure is usually caused by another disease or condition. Now, we've just heard that heart failure may be caused by various diseases or conditions, but one of those conditions, as I mentioned before, is ATTR-CM. So ATTR-CM stands for transthyretin amyloid cardiomyopathy. Again, that's transthyretin amyloid cardiomyopathy. There's different forms of amyloid, but we're going to focus particularly on the transthyretin form of that. It's a serious condition, but it's often overlooked, and that's what we're here to talk about it today. So later, we're going to talk about the symptoms of ATTR-CM, but before we do that, let's hear a bit about ATTR-CM through this video and its effects on the heart and other parts of the body.
This video describes what happens inside your body when you have ATTR-CM. We'll start by looking at a normal, healthy body, which makes many different proteins every day to help it work. Each protein has a different job. One of these proteins is called transthyretin, also known as TTR. Its job is to carry other substances through the bloodstream. TTR works well when it is neatly folded, but in some people, it can become unstable, misfold, and tangle together. These tangled TTR proteins travel through the blood and build up in different parts of the body, which can cause problems. In the heart, these tangled TTR proteins cause the muscle walls to stiffen and thicken over time. This means the heart doesn't pump blood as well as it should. Eventually, it can lead to heart failure. Doctors call this ATTR-CM. Tangled proteins can travel to other parts of the body, causing problems there too, including glaucoma or other eye problems, low back pain, and numbness, pain, or tingling in both hands or fingers, or in the feet. ATTR-CM is a serious condition that is often missed. It is important to find it early. So, talk to your doctor if you have heart failure and other symptoms, even if they seem unrelated to heart failure.
So, oh, 1 second, just a little feedback. So as we saw in the video, ATTR-CM affects the heart. It can cause many of the same types of symptoms as we see in heart failure. We already talked about these, which include feeling very tired or weak, having shortness of breath, being fatigued, or having an irregular heartbeat, such as a cardiac arrhythmia, as well as having swollen legs, feet, and ankles. Now, additional symptoms to those that were shown previously are more specific to ATTR-CM, can be associated with a number of different parts of the body. So I want to try to go through some of them because, as you know, there may be audience members or people that are listening that you may have noticed some of these symptoms and weren't sure how to put them all together. So you can have ruptured tendons or torn tendons. A tendon is where a muscle attaches to the bone, and this can affect mainly the bicep tendons or the Achilles tendon. You can have stomach or gut issues like diarrhea, constipation, feeling sick or nauseated, and the feeling of being full quickly. You can have pain or numbness that goes down your back or your legs. You know, we can be related to a condition known as lumbar spinal stenosis. You can have eye problems such as glaucoma. And again, none of these things in isolation mean that you have amyloid, but it can be associated with the symptoms, which make it hard to diagnose. Numbness or tingling in or pain in both hands or fingers is actually something that we see a lot in patients with ATTR amyloidosis, and can actually precede the condition affecting the heart by almost a decade. This is called bilateral carpal tunnel syndrome, and it's one of the most common symptoms of ATTR-CM. So not just one side, but if it happens in both hands. Joint pain, such as in the hip or knee, and then also numbness or tingling or pain in the toes, which is known as peripheral neuropathy, which is a condition we see a lot in patients with diabetes. So we'll move on to the next slide. There are two types of ATTR-CM that we want to focus on. Now, the first type is known as wild type ATTR-CM. The other type is known as hereditary ATTR-CM. Now, wild type ATTR-CM most often affects Caucasian or white men over the age of 60 and is associated with advanced aging. Now, that's not the type that we're going to talk about today, but understand that, you know, it's, again, the video showed that, you know, the video of how you have depositions of this transthyretin protein that gets into various parts of your body, including the heart. However, hereditary ATTR-CM is the type most likely to affect Black, African American, and Afro-Caribbean communities. The symptoms can show up as early as the age of 50 to 60 years old, and it can affect both men and women. Hereditary ATTR-CM can be passed down through relatives, whereas the wild type of ATTR-CM is not. So let's talk a little bit more about hereditary form of ATTR-CM. We've heard that it's passed down through families, but how does it actually happen? It's because of a change in the TTR gene, as we saw in the video. Everyone has genes which make up our DNA. Your genes are the instructions on how your body functions. When a permanent change happens in DNA that makes up a gene, it's called a gene mutation. Gene mutations or changes can be inherited or passed down from parent to child, or can occur spontaneously. Some mutations can lead to conditions such as the hereditary form of ATTR-CM. It's important to remember that if you have hereditary ATTR-CM, it's not your fault. It's caused by a change in the TTR gene, and it's not something that you've done or a behavior that you've done to get this condition. So a little bit about genetics, and I think this family tree is very nice to illustrate a point that I want to bring across. One of the gene changes linked to hereditary ATTR-CM is most often found in African-American families. It's often referred to as the V122I mutation and can occur in as much as 3 to 4% of African-Americans. Again, I'll repeat that part. The gene mutation is on the V122I locus and can affect around 3 to 4% of African Americans. So 3 to 4% of us sitting in this room today may be affected by this gene mutation. Now, this gene can be changed. This gene change can be inherited and passed down through relatives. For example, if your grandfather had this gene change, and he could pass it down to one of your parents or your aunts or your uncles. But having one parent or a brother or even a sister with ATTR-CM does not mean you will get it. Also, not everyone that has the gene change or the ATTR gene develops symptoms of hereditary ATTR-CM. Basically meaning that if you happen to do a genetic test and find that you have this mutation, it doesn't mean that you're going to develop heart failure from ATTR-CM, but you're at higher risk for it. So it's definitely important to know and screen in your family if you are discovered to have this.
Okay, time for another quick knowledge check on what we've heard so far. Question is, what causes
Mr. Pulliam, you need to unmute Mr. Pulliam.
again? Okay, another quick knowledge check we've heard so far. What causes hereditary ATTR-CM? Being overweight, eating too many fatty foods, not exercising, a change in the TTR gene. You just don't know. Now we'll wait for your answers. Okay, it looks like you guys are paying attention because that is the correct answer, is a change in TTR gene. Because hereditary ATTR-CM is an inherited gene change that may be passed down through relatives. Unlike other heart conditions, poor diet and lack of exercise do not cause hereditary ATTR-CM, although they may make heart failure symptoms even worse.
Thank you for that, Wayne. So early diagnosis of ATTR-CM is important. ATTR-CM gets worse over time, so it's important to find it early. But ATTR-CM is often overlooked or even mistaken for something else. As you know, I would say it's a condition that unfortunately is a great mimicker. It can mimic a lot of other disease conditions, which makes it difficult to diagnose. So don't delay. It's important to talk to your doctor if you have any of the symptoms of ATTR-CM that we discussed. So some important notes to remember, points to remember from this section are ATTR-CM is a serious health condition that can lead to heart failure. Hereditary form of ATTR-CM is caused by a gene change or a mutation that can be passed down through relatives. One of the gene changes linked to hereditary ATTR-CM is most often found in African-American families. It's often referred to as the V122I mutation, and around 3 to 4% of African Americans have it. Unfortunately, the signs and symptoms of ATTR-CM are often missed and sometimes can be very vague. ATTR-CM gets worse over time, so it's important to find it early to mitigate some of those symptoms. And that's why it's important to talk to your doctor if you have any symptoms of ATTR-CM that we've discussed today. In this next section, we will talk about how you or someone that you know can find out if they have ATTR-CM. So if you have heart failure or any of the symptoms that we discussed earlier, the first step is to find out if you have ATTR-CM is talking to your doctor. Remember that many of the symptoms of ATTR-CM may seem unrelated to heart failure, but if you have heart failure and those symptoms, you should really present them to a medical professional. Other possible warning signs or red flags for ATTR-CM in people with heart failure can include losing weight for no apparent reason, feeling lightheaded when you stand up, or having some heart and blood pressure medicines may make you feel worse. Because of the way the condition works, instead of a person with a weak heart gaining weight because of fluid retention, they actually lose weight because of muscle wasting. And also mineral loss in their bones. So it's very important if you notice weight loss with this condition to let a medical professional know. Now, while the signs and symptoms we discussed today don't mean that you have ATTR-CM, you should tell your doctor. They may need to do some further testing, and the more you tell your doctor, the better they can help you understand your condition. So now, once you've recognized the symptoms of ATTR-CM, and spoken to your doctor, what's the path to getting diagnosed? First, your doctor may order tests to find out how your heart is working and look for signs of ATTR-CM. If ATTR-CM is a possibility, then they will do another test or set of tests to help confirm the ATTR diagnosis. If you have ATTR-CM, your doctor will recommend a genetic test. Genetic tests are used to find out whether someone has the wild type version or the hereditary version of ATTR-CM. Now, genetic tests can confirm whether someone has wild type or hereditary form of ATTR-CM with either blood or saliva sample. If genetic tests confirm that you have the TTR gene change, your relatives may be at risk of developing ATTR-CM and should consider genetic testing. People who get genetic tests should consider genetic counseling. Again, a counselor is someone that explains to you the results. Again, just like I mentioned before, a positive test doesn't mean that you're going to manifest the disease itself. It just means that you're at higher risk and that you can also pass that on to offspring. Counseling can be useful before or even after getting tested to help you understand the diagnosis. So this is to make sure that a person understands the test results, the impact the genetic information may have on relatives, and also what the next steps are.
Okay, now it's time for another question for the audience.
Mr. Pulliam, you'll need to unmute again, please.
Okay, sorry guys, we're gonna go through that one more time. Thinking in general about seeking care for medical conditions, what is the most important factor that you consider before seeking care? Check all that apply. Reliable transportation, having a healthcare provider nearby, insurance coverage, available child care, elder care, time off from work, food or housing needs, and even COVID. I'll wait your answers. Okay, so overwhelmingly 75% of you guys said having a healthcare provider nearby. All right. Great choice. So again, thank you for your answers.
All right. Thank you again for answering those questions. And Wayne's doing a great job of moderating despite some of our technical issues. And, thank you for our live and our in-person audience for, working with us during this presentation. So in this section, I'm going to highlight some resources that can help you learn more about ATTR-CM and prepare for conversations with your doctor if needed. So if you're interested in learning more about hereditary ATTR-CM, there's information that can help you. Pfizer's Get the Message fact sheet is one great option with information about hereditary ATTR-CM, as well as symptoms of the ATTR-CM that we discussed. For our virtual attendees, this is now available in the chat. Now, yourheartsmessage.com/askyourcardiologist is a helpful website that contains information about ATTR-CM and how it's identified. Educational topics on this website include what ATTR-CM is and how it affects the body, how to look for signs and symptoms of ATTR-CM, how to talk to your cardiologist or other doctor about ATTR-CM, and how to help others by becoming an advocate for ATTR-CM awareness. The website also provides inspirational, supportive stories from real people with ATTR-CM. It provides links to support groups and resources. In addition, the website allows you to create a customized doctor discussion. This is important because when you go to the doctor, it's sometimes challenging to know exactly what to say, what symptoms that you feel that they may find important versus what you find important. And so having this guide is very helpful to be taken seriously by your healthcare provider. It allows you to print a customized script that can help you start a conversation about ATTR-CM for the next time you visit your physician or other provider. This is now available in the chat, again, for our virtual listeners.
Thank you, Dr. Hicks, for that informative presentation and sharing some of the ways people can learn more about ATTR-CM. Before we move on, let's ask another audience question. That question is, how would you like to receive more information about hereditary ATTR-CM? Please click all that apply. More events like this, your house of worship via community organization, your doctor, health fairs, email communication, and lastly, the voicesfortheheart.com website. I'll wait your answers. And it looks like overwhelming response is, how would you like to receive information about hereditary ATTR, which of course is a great choice, is to talk to your own personal doctor. So thank you. I would like to now introduce a special guest, Velma Henderson. Velma Henderson is an accomplished nurse, health administrator, and educator who has a close connection to hereditary transthyretin amyloid cardiomyopathy, both in her personal life and in her work as a healthcare practitioner. Velma has had 3 siblings pass away from the disease over the past 5 years. Velma herself is not a patient, but a caregiver with a healthcare background that is now committed to increasing awareness of this disease, especially in the Black, Afro-American, and Afro-Caribbean communities. Velma, thank you for being here and welcome to the virtual stage.
Thank you, Wayne. And I am so happy to be here. I thank you all for allowing me to be a part of this most important event. As you've mentioned, my name is Velma Henderson, and it was 5 years ago to the day that my world was rocked and my family changed forever. Because that was the year in 2018 actually, is when it started, when my younger brother was diagnosed with hATTR-CM. Now, Dr. Hicks talked to us about there being 2 types. The type that my brother had was the hereditary type. And because it was a hereditary type of ATTR-CM, it was recommended that his siblings, his brothers and sisters, and any children be tested. So 4 of my siblings, and I was included in that, 4 of the 7 that were alive at the time were tested. Out of the 4, 3 tested positive for the gene variant. The Dr. Hicks talked about that gene variant, the V122I. That is the variant that my family had. Now, Dr. Hicks also mentioned that one can have the variant and not have the disease. However, all of my siblings not only had the gene variant, but they had the disease. And all 3 of them have passed away at this point. My brother lived just a few months after he was diagnosed. And my sister, who was diagnosed the following year in 2019, died in 2021. And another younger sister who was diagnosed in 2019 died just a few months ago. So all 3 of them died with the disease. Now, my brother had 1 son. His son also carries the variant. He is in his 40s, so he is being watched. And that is certainly, one of the advantages to getting the testing. And my sister had 2 children. And we were told that if you had 2 children, there was a chance that very likely that one of them would be positive for the variant. But both my sister's children are in fact positive for the variant, and they are being watched and monitored. So this disease has certainly changed our lives. I tested negative, and maybe that's because I needed to be available for them. So that's one of the main reasons I'm so excited to be teaming up with Pfizer, Voices for the Heart, to encourage those who have heart failure and who might be experiencing symptoms that are unresolved to talk to the doctor or the healthcare provider about it, because it really maybe could lead to an early and appropriate diagnosis. Diagnosis is one is in fact carrying that disease variant. But this is especially important in Black, African American, and Afro-Caribbean communities. So again, I'm so happy to be here today to share my story.
Thank you, Mrs. Henderson. That is, a very unfortunate story, but I'm glad that you're here to share your experience, your personal experience as a healthcare provider and as a family member, which, is a burden that a lot of us share. And so we really appreciate your courage and your willingness to do this. I have a few questions for you that I think are going to help us understand a little bit more about your siblings' journey. So if you don't mind, I'll start with the first one. Were there any hereditary ATTR-CM symptoms you noticed in your siblings that they did not associate with the condition?
Oh, absolutely. When you talked about joint pain and pain in the hands, and it just happened that during that time, there was so much talk about carpal tunnel syndrome, and it was always attributed to, well, you've been on the computer too long, or, where you're positioned, yourself, and it was really not, hATTR-CM was not thought about, but all of them complained of the pain in the hands and joint pain. We thought, well, you're kind of young to be hopping around with arthritis, but they complained of joint pain and irregular heartbeats. Even with an irregular heartbeat, they was, well, my heart's beating funny, but by the time they would get in to see a physician, the EKG would look okay. So all of those symptoms and there were others, but they were just considered to be unrelated. Didn't relate them to anything called hATTR-CM.
I see. It could be challenging to make a diagnosis because the symptoms can be pretty vague. Had you or your siblings heard of ATTR-CM before their diagnoses?
Well, that's interesting because it was mentioned that I am a registered nurse, and most of my clinical career, I worked in the intensive care unit. I took care of people with heart failure and heart attacks, and I had never heard of it, and neither had my siblings. I didn't know anyone who had it. I probably did, but they weren't diagnosed. So no, we did not attribute any of the symptoms to hATTR-CM. It was an absolute shock to us when my brother tested positive for a disease we didn't even know anything about.
And I'm finding that it's a condition that is not well known, but obviously we're here today because of its prevalence in our community. So thank you again. Were you surprised to find out that the underlying cause of your siblings' cardiac issues were due to this ATTR-CM condition?
Oh, absolutely surprised, because we're talking about the fact that my family, we didn't know anything about it, but so many members of the healthcare community did not know either, because all of them were seeing physicians, primary care providers. And yet it was very late when even when my brother was diagnosed, it was not because someone suspected hATTR-CM, but they just didn't know what was going on. So they, in fact, he was diagnosed by a biopsy, and so it was an absolute shock. And even after some of them were diagnosed, there were still some healthcare providers who resisted the notion, who tried to dismiss it. Because even to say, I said to my sister, my sister was having cardiac symptoms. And I said, well, talk to your physician about your brother having ATTR-CM, see if he would recommend that you get tested. And there was resistance, because he said, well, oh, you don't have anything like that. So we were absolutely surprised.
Wow. So I guess in your position, you can probably answer this question. Why is it so important to talk to your family about genetic testing after a hereditary ATTR-CM diagnosis?
Well, it's so important, because if we need to get the diagnosis so we know what we're dealing with. Because the thing about hATTR-CM, it's progressive. It gets worse over time. And the earlier that we're diagnosed, we can start to work with your provider to set up a disease management plan. It also has implications for future generations, because by my siblings getting tested, and then their children got tested, so now their children can be monitored and they can be managed, and that would certainly allow them to have a treatment plan set up so that we can manage this disease. It's just so important that we talk to our family members and encourage, early testing.
You answered some of this question in your previous answer, but what's your advice for members of our community, the Black, African American, Afro-Caribbean community, who may be experiencing symptoms similar to your siblings and who have a family history of heart disease?
Well, I would encourage to talk to your physician or whoever your primary care provider is about it. And even if you see something on television, you see a commercial, whatever, talk to your physician about, listen, I'm feeling this, I saw this commercial and it talked about this hATTR-CM, and do you think that maybe that's something that we need to look at? And just continue. And if you don't get the results that you're looking for, or you don't think you're being taken seriously, then you need to maybe change providers and go and see someone else, because it really can be overlooked. Does not mean that your healthcare provider is bad. It's just that, as Dr. Hicks has talked to us about, the symptoms and the way it presents can often look like something else. So it's real important that we pursue and advocate for ourselves and for our family members.
I like that answer about switching doctors if you need to.
Yes.
Hemmed up in that, and
Yes.
I got my parents out of that habit, so thank you.
Oh, yes.
If so, and again, I know some of these questions may seem a little redundant, but I just really want to just put the point home. So if someone suspects that they have ATTR-CM, what should they do?
Well, I agree. We can't emphasize it enough that absolutely need to talk to someone. Just don't be silent, and don't be concerned about. Sometimes we think, well, I'm overreacting, and it's okay. It's a good thing if I got tested and I was negative. That's a good thing. But I got tested. So if you're negative, fine, that's great. But if you have these symptoms and they're not resolved, insist on getting tested. And if you want more information about it, there's a website called voicesforyourheart.com that you have all kinds of information and advice in terms of how to go about doing it. So absolutely don't be silent if you suspect that you might have ATTR-CM.
Yeah, and for those that didn't hear, that's www.voicesfortheheart.com. Something that I refer to patients
Yes.
to learn more about the condition. So my last question for you is, how did you help your siblings manage their hereditary ATTR-CM?
Well, that's really an important question. ATTR-CM, it is a difficult disease. It's a challenging disease. So first of all, I just started out by making sure that my family members knew that I was there for them, that I knew it was difficult. And sometimes that meant taking them to the doctors, taking them to the appointments, and even because this disease can be so overwhelming, just being the extra eyes and ears, taking notes so we can be sure that we've got whatever that we've been advised, what's the treatment plan, or even maybe something will come up new, during between visits, and just to go in and be able to help them explain what's going on, what the new symptomology is. And also, because it is progressive, it gets to the point sometimes you actually have to help take care of them, to help with just the activities of daily living. And because, as you mentioned, it does affect all the systems. It can. Sometimes just nutrition is an issue because they tend to lose weight, and food is not good. So even trying to help to fix meals for them that they could eat, and just being there. As I said, it is an absolutely challenging disease, and having a supportive family member can really help make the journey a little bit easier.
Well, I definitely want to thank you, Ms. Henderson, for lending us that information and telling us about your personal journey and your family. And again, I'm sorry for your losses.
Thank you. Thank you.
Know that their losses are not in vain. You definitely have helped to educate not just myself, but other members that are listening in person and online. So thank you again.
Okay. Thank you very much.
Again, thank you, Ms. Velma Henderson. It's time for another question for the audience. Question.
Mr. Pulliam, your microphone is off, sir. Mr. Pulliam?
I'm going to repeat this one more time. The question is, if you learned something new during this presentation, which of the following actions would you take? Visit yourheartsmessage.com, tell a family or friend about hereditary ATTR-CM, download the discussion guide, speak to a healthcare provider, or none of the above. And I'll wait your answers again. Thank you. So number one response, 86% of you guys said speak to a healthcare provider. 76% said tell a friend or family member about hereditary ATTR-CM. And again, no one picked none of the above. So I guess everyone's been paying attention that the main point is get the word out, see your healthcare provider, and make sure the family knows about ATTR-CM. So we have one more question for you, question number 6. Before we get to your question, Dr. Hicks, we've got one more polling question for you. After learning about ATTR-CM today and its symptoms, if you are concerned you may have it, which healthcare provider are you more likely to visit? 1, your cardiologist, 2, primary care, internist or internal medicine doctor, nurse practitioner, physician's assistant or PA, or an advanced practice professional. And I'll wait to see your answer. Okay, we see by the results. Most important thing is everyone's decided they're going to see some healthcare provider of some type of about whether they have the condition, but 57% of folks chose a cardiologist who they would speak to first. And there's nothing wrong with that. Thank you, Ms. Anderson, for sharing your journey with us today. And again, thank you, Dr. Hicks, for your presentation. I would now like to ask Dr. Hicks to answer a few of the questions that have come through our Q&A from the audience. As a reminder to the audience, please check the anonymous box when submitting a question in the Q&A, or your question will be kicked out.
Comment here, because you may not be online, you want to ask a question. I'm going to give you a slip of paper because I'm going to have to enter the question into it for you. And so if you want to ask a question here in the audience, I will give you this piece of paper and I will take the question and enter it in. So
Thank you, Roger.
Question.
Okay, well, after we go through the question and answers, if there is a question, by all means, give it to Roger, okay? I'll get you ready.
I'm ready.
Okay,
I'll be
how-
here afterwards. So,
yeah, be here.
presentation, we can answer.
Dr. Hicks, how common is ATTR-CM?
So ATTR-CM is often missed or diagnosed late. This means that we don't exactly know how many people in the United States have the condition, but based on data that we do have, ATTR-CM affects fewer than 200,000 people in the US. In other words, that's 1 out of every 1,650 people in this country has ATTR-CM, which makes it considered a rare condition by medical standards. And that's based on the US population. So it's a common condition amongst African Americans, but not a common condition in general. Anytime I deal with a disease condition, if it affects 1% of a certain population, that's high. So 3 to 4% of a population of people is considered very high from a medical standpoint.
What percentage of heart conditions among Black African American and Afro-Caribbean do we think can be attributed to ATTR-CM?
So it's another interesting question. Heart conditions like heart failure are more likely to affect Black, African American, and Afro-Caribbean communities compared to other racial and ethnic groups. We know that data for the last 20 years shows that African Americans suffer 3 times the rate of mortality for heart failure than any other racial or ethnic group compared to whites, Hispanics, or anyone else. So we know that 1 out of every 10 Black adults in this country also has a heart condition. ATTR-CM is a rare but often missed cause of heart failure, and it also gets worse over time. So it's extremely important to find it early and to manage it well, as well as talk to your doctor about it if you have the symptoms of heart failure and some of the other symptoms we discussed before, even if you think it's unrelated.
Mr. Pulliam, please unmute your microphone. Thank you.
Okay. Next question. What should someone discuss with their doctor if they have heart failure and some of the signs and symptoms of ATTR-CM that we mentioned in the presentation?
Sure. So it can be hard to know what to ask your doctor, especially if you find, especially when you first learn about ATTR-CM. So a few tips that I tell people are to always tell your doctor about any symptom that you're having. Even if the symptom seems unrelated, ATTR-CM can cause a range of symptoms, including numbness and tingling in the hands or fingers, especially bilateral carpal tunnel syndrome. This is a very important symptom to identify. If you notice or know someone, or if you happen to have that condition, we can diagnose amyloidosis, particularly ATTR-CM, almost a decade before it starts to affect the heart. So again, if you have bilateral carpal tunnel syndrome, that's something that is very common in this condition. Lower back pain, eye problems like glaucoma. Also, tell your doctor if any of your family members, particularly mother's side or dad's side, has a heart condition, because it can be passed down through families, ATTR-CM. You want to tell your doctor if you've had any tests in the past that to look at your heart, such as an echocardiogram, an EKG, or labs. We look at something called a NT-proBNP or troponin level, which could be elevated in these conditions. Lastly, you want to prepare a list of questions like from that yourheartsmessage.com website that we talked about. Prepare a list of questions or concerns to bring your doctor and even come up with a script if you need to, if you're concerned that you may have this condition.
Seems like some doctors may not. It seems like some doctors may not be able to put the symptoms together to come up with the diagnosis of hereditary ATTR-CM. Is that true?
Yes, the simple answer. This is a condition that is extremely hard to diagnose and is often misdiagnosed. I've had patients that have been misdiagnosed for over a decade, some more than that. And unfortunately, when they present with the suspicion for ATTR-CM, there's not much that medications can do to reverse the process, which is why it's been a difficult disease to diagnose. And even once diagnosed, we've missed it in the medical community. So unless you have a provider that recognizes the symptoms and is either an expert or knows something about amyloidosis, you can be treated by someone that has the best intentions, but is not getting good outcomes because again, they don't recognize the symptoms, which is why Pfizer and other companies have decided to do direct to patient education. This educational session is important because one thing that we've lacked in this discussion is empowerment. Empowerment as a patient, empowerment as a community. We should know if something disproportionately affects our community more so than any other. So that's why, I volunteer, well, not volunteer, I'm hopefully going to get paid for this. But, we take some of our time to, talk about this condition and, really spread the message because it's affecting people that I care for and it's affecting my loved ones as well.
Okay, a couple more questions that came in. Would seeing a cardiologist versus seeing a primary doctor have helped with the early diagnosis?
I think so. I think, a primary care doctor has to know a lot about a lot. As a cardiologist, I get to ignore a lot of things, other parts of the body, especially anything below the diaphragm, just, I'd leave to someone else. And so amyloidosis is something that's within our training. We're taught to recognize the symptoms more often. Even if you're not a heart failure cardiologist, any cardiologist has seen this condition before. They may not put it all together the first or second time, but eventually they start to at least have concerns for it. There's certain things that we look for on testing. So if I get an echocardiogram, which is an ultrasound of the heart, and I see that all the walls look thickened, my suspicion goes up for amyloidosis or some type of infiltrative disease, such as misfolding proteins in the heart. If I do an EKG on a patient, an electrocardiogram, where I put electrodes on your chest, and I look at the electrical conduction of the heart, and I see that there's very low voltage, I'm concerned, especially if I have a thinner patient that I can't explain because of distance between the heart and the electrodes. And especially if I have low voltage and a thickened heart on exam, there's a discordance. Like that doesn't make sense. If I have more muscle, I should have higher volts. And so that can be a sign that, a suspicion or raise the suspicion that this person may have amyloidosis. And that's something even as a general cardiologist, we're trained to pick up on.
Okay, thank you, Dr. Hicks. Another question, final question, which probably a lot of folks have been through this before. It says, are doctors that treat carpal tunnel, are they brought up to speed on ATTR-CM?
Not all. Actually, not most. If you go to, some university hospitals, they tend to have specialists that, especially if they work with their neurologist or cardiologist, they may be more up to speed. I know at one of my former institutions, we talked with our hand orthopedic physician that if you had a patient that you were performing a bilateral or had history of bilateral carpal tunnel syndrome and you were doing a release procedure, we would ask them to actually send a piece of this synovial tissue to the lab. And many times that would come up not many times, but at least like 30% of the time would come up positive for ATTR. So you would see the transthyretin, and we know that if you can detect this almost up to 10 years prior to having involvement of the heart. So essentially, if you find it, you can potentially prevent someone from developing heart failure. So again, know that bilateral carpal tunnel syndrome is not a common condition. It's not something that we normally see, even for people that use their hands or that are typists. So if you have that, and you're African American and you have a history of heart failure in your family, you may want to look a little bit more closely to see if you have the condition.
Dr. Hicks, I know that I said it was the final question, but I have one more question for you. And I'm sure everybody's thinking the same thing. How much does it cost to receive diagnostic and genetic testing for ATTR-CM? And are these tests covered by insurance?
So I don't have those direct answers. I know that many companies will work and have access to genetic testing. I know that it's covered by patients when I order it. Also, genetic counseling seems to be covered by most insurances. I don't have the exact cost, but they recognize that it makes sense. If they can find a genetic cause, they can prevent further conditions of the disease, they save money. So it's one of those conditions that I've not been denied from an insurance standpoint, but I don't know the numbers for the direct costs. All right. Well, I want to thank you for your questions, and we're almost to the completion of our presentation. Again, I just wanted to highlight a few more things in this presentation before we go. So after this program, we hope that a few takeaways and a few important messages that you get are ATTR-CM is a serious health condition that can lead to heart failure, but is often overlooked in Black, African American, and Afro-Caribbean communities. Anyone with heart failure and unexplained symptoms of ATTR-CM should consider talking to their doctor about the condition. Remember to tell your doctor if you feel, and remember to tell your doctor about how you feel and about any symptoms that you're having. And if it is confirmed that you have ATTR-CM, you should talk to your doctor to understand the next steps which are right for you, which I won't go over in detail, but again, depending on what you have and how late or early your diagnosis is, the steps are going to differ. Lastly, consider sharing the information you learned today with your friends and family.
Okay, that's going to take us to question number 7. We're down to our last polling questions. We want to know, how did you learn about today's event? Please check all that apply. Radio, Pfizer website, social media, Facebook or Instagram, church, community or organization, newspaper. I'll wait your answers. So looking at the answers here, 63% said church, community, organization. Social media came in second, Pfizer's website, radio, and of course, nobody's reading the newspaper anymore, so that was the last one. All right, so thank you for your answers. Okay, this is where the rubber hits the road as far as the presentation. The question is, how likely would you be to recommend one of these events in the future, either to your church or community, or other outlets where the community can find out about ATTR-CM? Not likely, likely, or very likely. And I am very interested in your answers. Thank you. All right, very likely. 68% said they would recommend this. 30% said likely. Those folks don't get to eat today. That said 30%. No, a great response though. The main thing is that you would recommend it and would hold something in the future. And we really appreciate the feedback. In closing, remember to talk to your doctor if you have heart failure or experiencing any signs or symptoms of ATTR-CM. Visit voicesfortheheart.com for information that can help you learn more. I want to thank everyone for attending this evening. I want to thank Kappa Alpha Psi and the use of the KYCC, our Kappa Alpha Psi Youth Community Center, Woods Adult Day Center, and of course, Pfizer. And this now concludes our program. For those of you who have not signed in, please circle back and sign at the front desk. We have a count of those in attendance, and enjoy the food. And Dr. Hicks will be here for further questions, for further answers. But this concludes the program. Thank you very much for coming out this evening.